Good afternoon. My name is Dr. Angel Chin. I'm a medical oncologist at the University of Michigan, and it is my pleasure today to talk to you about EGFR mutant non-small cell lung cancer. Here are my disclosures. So we know now in 2022 that non-small cell lung cancer is made up of different drivers. When I say drivers, I mean that there are changes in the DNA of the cancer itself. And when these changes happen, these mutations, it changes how the way the cell functions. And the way I like to describe it to my patients is that it turns on a signal. It's an on switch for the cells to continue to grow without really being under the body's control. Luckily for us, now in 2022, we have all these different identified mutations. I have those in the green boxes. And we also have drugs that act then in the way I describe as an off switch. And the one today that we're going to focus on is on the far left, and these are the EGFR sensitizing mutations, for which you can see that there's 5 different drugs that are already approved in this setting. So what is EGFR really? So EGFR stands for epidermal growth factor receptor. And there's actually a family of 4 of them in the ERBB family, and EGFR just happens to be ERBB1. And you see that there's 3 others. When we talk about receptors, what we mean is you'll see that there's that green Y. That's a simple way to depict how these proteins work. So what happens is that there's a signal that comes to this receptor, and when the signal is received, the downstream effects will occur, and I can illustrate that here. So there's a signal from outside the cell, goes in the receptor, and that leads to different signals. In the case of EGFR, those signals lead to cell growth. What happens when you have an EGFR mutation is that now you don't really need this external signal, that blue dot, that this downstream pathway is always on. So irrespective of whether or not the cell's receiving a signal, cell growth is always happening. And that kind of, in a very simple way, defines what cancer is. It's just cell growth that is not being controlled by the body. EGFR is actually a normal part of your body. It's found in the skin, your GI tract, aligning different parts of your body. But when it becomes mutated, as it can in lung cancer, that's when the problem arises. So in non-small cell lung cancer, we think it accounts for about 10 to 15% of all the non-small cell lung cancers that we see in the United States. We most commonly find it in a specific type of non-small cell lung cancer called an adenocarcinoma. We also find it more frequently in patients who are female and patients who have light or never smoking histories. However, I really want to emphasize that it is always important to check for this. So even if a patient is male, even if someone has a smoking history, it does not mean that they for sure do not have one of these mutations in EGFR. And therefore, it is always important to check, especially when we're talking about metastatic disease. And it is considered a standard of care and is recommended by multiple national guidelines to check.